Mother Constantine was very instrumental in the beginnings of this hospital. Mother Constantine was the person who interacted with all the county and municipal, but mostly county officials to get what now would be considered a certificate of need.
I was a brand new nurse when I started at Holy Cross. I was an emergency room nurse from probably 69 to 71.
I started working at Holy Cross Hospital in about 1969. While I was there, I was director of dietary services, which is now called nutrition services.
I was on the board at Holy Cross many years ago, way in the 70s, I believe it was.
I came to Holy Cross in 1971. I was there ever since.
The history of Holy Cross Hospital is like any of our Holy Cross hospitals throughout the United States. It's one of quality care for the patients and the development of people and teamwork between the staff, the nursing, the physicians, and high technology. And it's continued to be more so over the years and continued to develop new programs and meet the needs of the people.
The hospital is really the only workplace that I'm aware of where every single day you see the mystery of birth, you see the mystery of death. Every day we have to walk with our patients and our families and with each other in trying to make sense out of the mystery of human suffering.
Looking through these newspapers from Holy Cross Hospital makes me realize how fortunate I've been to work with so many wonderful people. If you notice the smile on their face, that's the way they were when they came to work every day. But it emulates what all of our employees at Holy Cross are, welcoming and loving their work and loving working with people. I can't tell you how very devoted all of them were and are, to our mission. When you stop and think about it, I mean, you're just so grateful that you had the opportunity to share life with them, and you never forget that.
You talk about the mission. I think at Holy Cross, I have been so deeply aware and appreciative of the way the leadership team have tended to the mission of the Sisters of the Holy Cross, have really tended to the mission of Holy Cross Hospital today. And to me, it's very, encouraging. It gives me a lot of hope as I look to the future.
My experience was that the staff really loved the sisters and appreciated them, and I think we made a big impact on the staff, and they made a wonderful impact on us too.
The atmosphere in the hospital was really a team effort. We did some really good things and had, I think, a real pride in the work that we did. I think that was really what was so common among the team. There was real pride. We really liked working at the hospital, and there was a good rapport among the team members.
I was the OB supervisor for a year. I did patient education for OB. It was everything to do with OB. My time at the clinic at Holy Cross Hospital was the most gratifying, meaningful time of all my years in hospital work. I was really caring for mothers that needed me. And not only the medical care, but the kindness and compassion. It felt just wonderful because I was involved with the poor patients who came from every country you can imagine. The patients didn't have any insurance, and I loved it. I loved the mothers.
The one thing I've also been very impressed with is the amount of community give back. The hospital is so aware that it is in Montgomery County and that it gives back to the county, to the people of the county.
Every day I pray with a lot of gratitude for the people that work here because they're incredible.
Some advice I would offer, I think, to the staff at Holy Cross Hospital is to remember that as a staff person or a physician, you are there really representing the founding group, which was the Sisters of the Holy Cross. And the motto of our founder, Father Basil Moreau, was, see what needs to be done and do it. And I think that's an underlying principle for everyone to pay attention to, that no matter what my role is, I have to see what needs to be done and do it in a compassionate way.
In the future, we have to never lose sight of what we're all about, that we're here to fulfill the mission of Jesus. And if we lose sight of that, then we're just another organization.
Remember the heritage and all of the people who made it possible for Holy Cross to be there now and for each of you to have an opportunity to work here. And so you also will be leaving that legacy for others who will follow you.